Hello, my name is Mandy Larson, and today my speech will be on the Asperger's syndrome. Having a child with a disability is always a constant struggle, even more for the child than the parent. But with fully educating yourself and using the resources available, you can make everyone's life a little bit easier. What is Asperger's? Asperger's is a high-functioning form of autism. Hans Asperger, an Australian physician, first diagnosed the symptom in 1944. It wasn't until 1992 that it became a distinct and diagnosed syndrome for more. Signs and behavior of the Asperger syndrome is significant ongoing impairment of social interactions, multiple nonverbal behaviors such as a lack of eye contact, few facial expressions, awkward clumsiness, body postures, gestures. It can be from tapping a finger to having to have everything into a certain pattern. Restrictive, repetitive patterns, behavior, again going back to having everything in a certain way. Repetitive motor mannerisms. No general delay in language. Accustomed to cognitive development and adaptive behavior. This is a contrast to the typical development of autistic children. Screenings that can be done to see if your child has the Asperger syndrome is, according to MD Marina Benjamin, there's different tools that each doctor will use. Depending on the tool that doctor uses, actually has different outcomes, different diagnoses. So if you're not happy with the first diagnosis and there's other things that you want tested, definitely request or ask that those are done. Again, because every doctor has their own tool that they use. A lot of times it does not become apparent until about age 5 or 6, because that's when there's more speaking, the children go into school. More tests are done to see if there is a delay of any sort going on. According to the National Institute of Neurological Disorders and Strokes,